Hi there, my name is Ethel Nachimoli Mpungu, a psychiatrist and a senior lecturer in the Department of Psychiatry, Makerere University. 3 years ago, I had a bold idea, and that idea was to develop a group support psychotherapy intervention to be used as a first-line treatment for depression among persons living with HIV/AIDS. 3 years down the road, we developed the intervention. We proved it was highly effective against depression, and our results were published in a world-renowned journal, The Lancet HIV. We are back in Northern Uganda, scaling up our project to 3 huge districts in Northern Uganda. And the way we are starting our project is by conducting stakeholders meetings in each of the 3 districts. We were in Padé district, where we met all the key local government officials. Group support psychotherapy is a counseling intervention where you put people in a group, and these people are guided by a leader. And in our project, we chose the mental health workers. We chose the mental health worker to be a leader. We trained them to lead these groups.
As Minister of Health, we are committed to support this project because it agrees very well with the Minister of Health policy, which is integration of mental health services into general care using cultural and contextually relevant programs. For us, our people are rural, our people live in communities and family settings, and this kind of intervention is best for them.
From the idea generated today, I see that it is very involving and it is very useful. Because where we don't focus so much as at hospital management, but also at community level, I think this is very useful.
As a district, we have really been having a big problem. So this project is actually has come timely. It will only not address the issue of HIV, but it will also address the other factors.
Now that this intervention has come, the success story can come out just like we have shared the one of Mr. Chan. So really, we appreciate, and it is very much welcome. I hope I will take it up with the church members, and we sensitize our Christians and see how best we can help them to come out of the situation they are in, the depression.
We found that patients with group support psychotherapy, more of them were engaging in income generation. More of them reported acquiring new assets. They belong to saving groups, and more reported having enough food for their household.
GSP is one of the solutions to our people down there in the community. See, depression is a disease, as I say. But since the program has come, it will help people to go back to their approach of living well.
So before you give people your money, just to be sure that they are mentally okay. So we want to thank the project. I'm sure it is going to make an improvement in the way HIV is being managed.
Depression stops people from functioning. Depression kills. Untreated depression can progress until a person commits suicide. So as Minister of Health, we are very committed to this project and to what call upon the teams which are here in the district, the leadership.
I have interacted with a few people and they say, by the way, I'm tired of this one, it's too violent. And so even the attendant becomes more traumatized. We need to look at ways of bringing all that together.
Indeed, I would like to appreciate very much this initiative that you have taken, and I urge that you continue with this. Recovery has to be in all aspects. We have a role to play as religious leaders.
The purpose of these meetings is to explain to the district leadership about the intervention that we developed and how it is going to help the communities that they lead. And we hope that when they do understand how the intervention is going to help their people, they can then mobilize their communities to seek this treatment. If they see that they do have depression symptoms and that they can be helped by the group support psychotherapy, they should refer them to the health centers where there will be people that we are going to train to deliver this intervention. We have formed a collaboration with the Ministry of Health of Uganda, with the AIDS Support Organization, which is an indigenous organization supporting persons living with HIV/AIDS, together with Makerere universities. And each partner has their role to play in this project. It wouldn't have been possible without the support of our funders, including Grand Challenges Canada, who funded our pilot project and are now funding this second phase of the project, as well as MQ, Transforming Mental Health, a charity from the United Kingdom that has given us funding to ensure that actually we do a long-term follow-up of participants in this project, which include the health workers we are going to train, as well as the persons living with HIV/AIDS who will be treated by the lay health workers. We are going to follow them up for at least up to 2 years, and we'll be able to provide long-term data about the effectiveness of group support psychotherapy. The way we are actually scaling up this intervention is by training primary care health workers in government facilities to learn how to recognize depression and then offer group support psychotherapy as a first-line treatment. To sustain the delivery of this intervention in such a poor resource setting, we need to have the health workers in the health centers train their lay health workers who they work with in the villages. If a lay health worker in the village can deliver group support psychotherapy, this means that persons affected with depression can have this treatment right in their villages. They would not have to walk long distances to health centers to come for this treatment. So we are very excited to be back in Northern Uganda to investigate whether this mode of delivery of group support psychotherapy can actually work.